Hello, everyone. Welcome or welcome back to another session of A Day with your fertility specialist. It is always lovely to have you here. Thank you for joining us. We do appreciate that every time, every click, every like, and every share. Okay, on that note, we would like to encourage you to share this with someone that you think will be interested in today's topic. We're talking about hydrosalpinx. I know it sounds really interesting, doesn't it? So, yes, do share it with someone you know will be interested, and then stick around until the end of this so you learn a lot more about this. If you've heard of it, if you have been diagnosed with it, if you've been in circles where this word has been thrown around and you want to just learn and you just want to know more about this topic, then yes, this is the right place for you to be. Today we are joined by Dr. Kenneth Ekuda. Hello. Welcome, welcome. Lovely to have you. Yes. So if you're joining us for the first time, Dr. Ken is a fertility specialist. He is a gynecologist, minimal access surgeon as well. I mean, who better to learn about this topic from, right? So
Sure.
yes, today we're going to be talking about that. And before I forget, I'm your host for the day, Joanna Damino. So yes, let me direct your questions to Dr. Ken. Right? So, Dr. Ken, hydrosalpinx. Could you tell us what exactly this is? I know hydro already has water in it, but the other one seems like a foreign, kind of like a chant or something. So what exactly is hydrosalpinx?
Like snake.
Yeah,
Uh-huh.
exactly.
Yeah, sapinges.
Hmm.
You know, it's it's a fallopian tube.
Okay.
That's the original name of the fallopian tube, salpinx. It
Oh.
derives its name from snake. The
Hmm.
snake moves in a kind of coily way.
Yes.
Serpent, sapinges.
Yes.
And if you look at the fallopian tube in a real life specimen, or in a human, in a woman, it's just like the shape of a snake. So it's salpinx, the
Okay.
fallopian tube, the fallopian tube. So if a woman has two fallopian tubes, she has two salpinges.
Okay.
you know, and hydro, just as you highlighted, means
Hmm.
water. But in this case, fluid, a fluid-like substance, because it could be anything.
Okay.
So hydrosalpinx means collection or accumulation of a fluid-like substance,
Hmm.
you know, in the fallopian tubes. The
Interesting.
fluid could be the pus, it could be a pus, it could be blood, it could be just a poisonous fluid from inflammatory substances,
Hmm.
you know, usually when a fallopian tube is bad or blocked at its end, you have a fluid accumulating in it.
Okay.
So that's actually what hydrosalpinx means.
Hmm.
And it could be in one of the fallopian tubes or in both, you know. And when you have it there, it just compromises a whole lot of things.
Yeah,
So
I'm sure it does.
hydrosalpinx means fluid
Hmm.
or fluid-like substances in the fallopian tubes,
Okay.
in the lumen of the fallopian tubes.
Okay. Well, you said in the fallopian tube, that I was like, fine, and then you went in the lumen. I was like, okay,
Yeah,
here's the doctor and you
inside,
talking.
inside.
So how does this actually happen? Like, what makes this occur? I mean, I can't even begin to imagine how you get fluid in the fallopian tubes. Where does it come from? What leads to this collection? As a matter of
By
fact.
the way, the woman reproductive organ is very complicated.
Hmm.
You know, yeah, that of the man is kind of complicated too, but as a gynecologist, I'm more used to that
Yeah.
of a woman. You have the cervix, you have the uterus, and in the uterus you have the uterine lining. You have the layer below the uterine lining. Then you have the muscle layer of the uterus. Then you have the outer layer of the uterus. Then you now have the fallopian tubes,
Wow.
and then the fimbrial end of the fallopian tubes.
Hmm.
Then you have the ovaries and all the complications that goes with the ovaries. So, and this female reproductive organ is very dynamic, always changing form.
Yeah.
Within a month, it changes like 2 to 3 times the
Tell me
forms,
about it.
and nature. So you asked how the hydrosalpinx happens. So
Yes.
now the fallopian tube, just like you heard the word tube, tube has uh, a hole in it, and such that if water is poured inside the tube, it flows from one orifice and gets out through the other orifice.
Yeah.
So that's the same when everything is okay. And now these fallopian tubes have what we call epithelium that secretes fluid on its own
Oh, okay.
to improve the function of these fallopian tubes. Then it has some hair-like structures, in it that helps that beats in a direction that helps in conducting eggs from the hands of the fallopian tubes, which is the fimbrial end of the fallopian tubes, to where fertilization happens, and then pushes it to where implantation happens.
My gosh.
So, as tiny as the fallopian tube is, has a very important function.
Yes.
So now a lot of things could go bad. If a woman has infection, for instance, infection from the vagina, it could move upwards,
Okay.
yeah, and get to the fallopian tubes and damage these structures that I mentioned. Can damage the epithelium, can damage the hair-like structures, we call them cilia, that help in beating in the direction that eggs move or that
Okay.
fluid gets out, and then infection can cause inflammation around all of these tiny cells and structures. And then inflammation can heal with adhesions in that tiny structure. And once that happens, it could cause a blockage of the fallopian tube. Then the blockage can be in the middle, it could be at the end of the fallopian tube. And then, in addition to the blockage, it could alter the function structures. And then the fallopian tube scenario is that the inflammation may be so severe that it blocks it. It causes a blockage so that the tube is not open through and through.
Completely.
Yes. So when the body produces its fluid, for instance, the uterus produces its fluid. Usually, women have what they call this not discharge, what they call normal discharge. It comes from the fallopian, from the uterus rather. And then sometimes this fluid flows in any direction, flows out and can flow. And sometimes menstruation can flow back. Infection themselves and inflammation. And now, because there is a blockage, the fluid cannot flow up the fallopian tubes through the fimbrial end or flow downwards, to the vagina. So it just gets trapped
So we have the collection you talked
in the
about.
fallopian tubes. Then you have the collection. So infection is one thing that can cause this abnormal collection, and the infection and the consequence of inflammation leading to damage of the cilia, of the epithelium, or of the anatomy of the fallopian tube.
I see.
So another thing that could cause that could be surgery.
Okay.
Yeah, sometimes when you do surgery and the body decides to heal with some inflammation and adhesions,
Yeah.
the tube may just be trapped in the inflammation or in the adhesion rather. And so there is no continuation of flow of substance,
Okay.
whether the fluid that the body produces on its own, or blood that gets there, or infection that flows up there, and all of that. So fluid get trapped there.
Okay, so it's not like it's coming from a different parts of the body. Say if I drink too much water or if I insert too much, like some ladies would douche, and it's not really like that where it's coming
No,
from.
no,
It's
no,
the
no.
structure of
Oh,
the
yeah.
reproductive system itself.
Exactly.
Oh,
Oh,
okay. I
yeah.
see.
Exactly.
I mean, because it does sound a little bit like,
Okay,
how
so
does
actually,
water
you mean women actually
get?
wonder how water gets there?
Yes.
Okay, that's why I choose the word not water. Fluid-like
Fluid, yes,
substance.
fluid.
Yes,
Fluid
and it
like
could be
substances.
pus, it could be blood, or product of inflammations.
Yeah. Yeah.
And then they're coming from the body itself. So this bacteria, for instance, common things that affect women and get to that point, like pelvic inflammatory disease, what they call PID.
Okay.
A lot of times bacteria that cause them.
Yeah.
These bacteria cause inflammation. And you have a lot of product of inflammation, which is fluid containing substances and structure from bacteria or organism causing it,
Yeah.
inflammatory substances from the uh, human immune
Immune
system,
system.
all of that. So they just accumulate, just very become very toxic,
Hmm.
and sometimes it's just blood, and sometimes it could be adenomyotic cyst that's broken that has gotten into that place, and sometimes it
Wow.
may be just just menstruum
Hmm.
flowing to that place, and because it is not patent through and through, and function of the cilia have been altered, so they just get static there.
Yeah. Okay. Okay.
Yeah, so that's it. So sometimes endometriosis with complication of endometriosis, which is adhesions, could cause the fluid to be retained there. So it's not the water the women drink.
Yeah.
It's just a product of altered physiology,
Okay.
or infection,
Mm.
or dynamic of inflammation following surgeries
Yeah.
that could cause some of these structures to be compromised.
Yeah.
So the fluid happens that way.
Okay, that's
Uh-huh.
fair.
Yeah.
Just for anyone out there that is wondering,
I
because we
never thought
started
of
with
this, man,
hydro.
but that's interesting. Hydro.
Yeah, so you did mention endometriosis and adenomyotic structures. I just want to remind our viewers
Uh,
out there that we have spoken about this and we have videos up on that. So if you're trying to catch up a little more, you don't really understand these terms well, we have things out there for you. And that's why we're here to inform you and to teach you a little more every day. So yeah, does this show up in a particular way? I mean, are there symptoms that you can look out for or that someone might experience when they have hydrosalpinx?
A good number of times, hydrosalpinx are complications
Mm.
or an aftermath of an abnormality, which could be complication of surgeries, complication of infection, and all of that. They could be without symptoms.
Okay.
A lot of time they could be without symptoms. But if infection is going on and there is accumulation of fluid following inflammation, during those active infection, you could have pain.
Hmm.
Yeah, but occasionally too, you could have very dull, nagging pain just around the lower flank of the woman.
Okay.
But a lot of times they go without perception, and then they become an incidental findings during some clinical investigations,
Hmm.
usually following fertility
Yeah.
evaluations. Want to
Getting
see,
there.
because you want to see if the fallopian tube of a woman is working, is
Hmm.
okay, and why she's not getting pregnant. So one of the common investigations is to check the fallopian tubes,
Hmm.
either doing what we call the HSG,
Okay.
yeah, or to do a laparoscopy and the dye test. So when you do all of these investigations, you just find out that this woman has these things.
These things, yeah.
Yeah.
I was going to head in that direction because I mean it's a day with your fertility specialist, right? We're
Uh-huh.
going to talk about fertility.
Yeah.
And I was wondering how, this gets to be diagnosed, but that's actually interesting.
Sometimes it could be so big
Mm-hmm.
that you could see it from ultrasound. Oh
Wow.
yeah, you
Oh
see it
wow.
from ultrasound. Sometimes it could be so big you could see
Hmm.
them on ultrasound.
So does that take like years or it's just I don't how
Oh no, we can't actually put a duration to it. We
hmm.
just complication of just pelvic infection or pelvic abnormalities. So and one is that the fallopian tube has lost its function.
Yeah.
Yeah, and it's rather now be detrimental to future fertility.
Mm-hmm. So
Yeah, that it is.
it affects the
It can
whole
affect a whole lot of
thing, just
things.
that tube.
There's
Right.
yeah, one or two of them
Oh,
can
wow.
affect a whole lot of things.
So how do we go about that? Like structure because is it something that can be reversed or do you have to look into other treatments, especially with regards to fertility?
No, when you're looking at fertility, for instance, and you have to deal with hydrosalpinx, yeah, the only thing advisable is to eradicate the hydrosalpinx,
Okay.
get rid of the fluid.
Hmm.
That's the most important thing.
Okay.
Get rid of the fluid, and there are different ways to do that. Yeah, but then I think I like to draw to be a little bit aggressive
Mm-hmm.
and be a little even more. Uh, uh, yeah, the word is aggressive actually, but to push my boundaries a little.
Okay.
That even if advanced fertility care is not being considered, and a woman is considering spontaneous pregnancy,
Hmm.
and the hydrosalpinx is found, it's good to get rid of the fluid.
Okay.
Yes,
Okay.
because you see, most times it's just those of us who practice assisted reproduction technology that tend to want to address this issue.
Yeah, I can
The
imagine.
regular gynecologist usually would just watch the woman.
Hmm.
If she gets pregnant, fine. If she doesn't get pregnant, you think of the way to go.
Oh,
But I think it should have the same for me. Whether pregnancy is spontaneous or assisted, they're all pregnancies, and they
true.
should be given the same conditions.
Yes.
Because the same effect that hydrosalpinx would have on a spontaneously conceived pregnancy is the same with the effect it will have on assisted reproduction
Yeah.
technology.
Hmm.
So they should be dealt with the same way. So if or when hydrosalpinx is seen, whether IVF is being considered or not, so long as the woman is interested in getting pregnant, she should get rid of the hydrosalpinx.
I mean, yes, because you did say it already. Like it does affect the whole function and structure of the
Exactly.
fallopian tube. So in the end, it's still affecting the journey, whether it is
Exactly.
assisted or not.
Exactly.
Yeah.
And
So.
the painful part is this most times when you leave it unattended to,
Hmm.
if pregnancy happens, pregnancy gets complicated.
Wow.
One, a lot of women may get ectopic pregnancy from that because
Hmm.
the fallopian tube is not functional. They may have ectopic pregnancy. And this
Yeah.
is one of the most dreaded complication of
Pregnancy.
gynecology, is ectopic pregnancy,
Hmm.
because it's about the tube. And when fallopian tube are not functional, they could just give ectopic
Hmm.
pregnancies. Yeah. Most of the ectopic pregnancies because of poor functionality
The
of
fallopian
the
tube.
fallopian tubes. So they should be gotten rid of. And now the question is, how do you get rid of
How?
them?
Yes.
You know, yes. So there are different ways to get rid of the
Hmm.
hydrosalpinx.
Please.
You know, maybe we'll look at it the very simple way.
Yes. Let's do
One is to drain it. If they are big enough to be drained,
it.
you drain it. You could actually drain it and give a woman a course of uh, antimicrobial medications following culture and sensitivity,
Hmm.
and hope it doesn't reaccumulate. But if it reaccumulates, then you have to go further with your treatment. And the
How much
treatment
further?
would be to remove the fallopian tube.
Oh wow.
Exactly.
Oh
To remove
wow.
the fallopian tubes, what we call a salpingectomy.
Hmm.
So you remove the fallopian tube. That is, you're getting rid of it completely.
Completely. Yeah.
So what I said initially was a conservative approach. Because we meet all kinds of people, and there are
Hmm.
women who wouldn't want to hear the word surgery.
Yes. True.
Yeah, they wouldn't want to hear the word surgery.
That's true.
You know,
That's
you
true.
you 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 will find those kind of women. So you give them the care that it's acceptable to them or by them.
Hmm.
So, and when you want to eradicate it, it could be done commonly laparoscopically
Okay.
through minimal keyhole surgeries. So you
Okay.
just cut off the fallopian tubes and take them out,
Mm.
or take out the tube that is affected.
Yeah.
Yeah. So some other things that could be done is to apply clips at the end of the fallopian tubes where it gets connected
Okay.
to the uterus itself. You
Hmm.
apply a clip. So the clip just cut off communication between the fallopian tube and the uterus.
So, but the fallopian tube is still there,
It's still there.
and then
But
it's just.
you've cut off the communication so that nothing comes from the fallopian tube into the uterus.
Oh, okay.
Yeah.
Okay, but does that have any, would I say, adverse effects? I mean, what's the point of having it there? Still, sorry to ask, but what's the point of having it there if it's there's no, communication and it's already this condition there? Because definitely there's no way anything can go in or go out.
Exactly.
So
So no, every day you meet all kinds of people who feel that some part of their body shouldn't be taken out.
fair enough.
Yeah.
Fair enough.
So you just clip it.
Okay.
So that the reason the problem with the hydrosalpinx, with the fluid there, it's that if it trickles into the uterine cavity,
Hmm.
it causes problem.
Okay.
It can physically wash out the pregnancy, so you have early miscarriage,
Oh,
or
wow.
usually the fluid is toxic. You can imagine a fluid with all the combination of elements that I've mentioned,
Mm-hmm.
element of inflammations, maybe pores from
Yeah,
bacteria, and
bacteria.
the product of bacterial metabolism, stale blood and all of that,
Oh,
all in one place.
can you
Then
imagine?
trickle into the uterine cavity
Mm-hmm.
and meet a primitive embryo that is trying to implant.
Mm-hmm.
you know, it kills it immediately. So it either kills it immediately or it physically washes it off. So whatever you do to stop that from getting into the uterine cavity, at least it's
It's
helpful.
a plus.
It's
Mhm.
helpful and saves the pregnancy.
Okay.
So uh, it's okay to remove the fallopian tube either by open surgery
Mhm.
or keyhole surgery, you know, or to drain and apply antibiotics depending on the sensitivity if it doesn't reaccumulate. Yeah, but whatever it is, the fallopian tube is useless and it needs to be taken care of. So
At this point,
those are the
yes.
things to expect. But there is also another treatment that is popular right now. I think you can do it with hysteroscopy without necessarily
Oh,
cutting the woman by any
okay.
means.
Okay.
Yeah, so with hysteroscopy, for instance, you could use a source of energy to coagulate the connection between the fallopian tube and the
Hmm.
uterine cavity. We call it the ostia or the
Okay.
ostium.
That's
You know,
interesting.
so when you coagulate it, inflammation happens around there and it heals with fibrosis. So it blocks the connection.
Hmm.
So you can do that with hysteroscopy without inflicting any pain on the woman.
And that's not a surgical procedure?
It's a surgical procedure, but
Okay.
it's a very minimally invasive surgical procedure.
I was going to ask because I mean, you did say you said rightly. There's some people that just don't even want to hear the word
Yeah, but
surgery.
hysteroscopy
Yeah.
is can be done without even anesthesia.
Okay.
Exactly. So you just put the camera through the uterine cavity and then you
Hmm.
coagulate it. And I think we do that a lot for those who are scared of surgeries.
Yeah.
All we want to get rid of is to eliminate the risks of toxic fluid
Coming back
from
into the
the
uterus.
fallopian tubes trickling into the uterine cavity when we're preparing for IVF, for instance.
Okay.
So we do that a lot. So, and just within a minute or two, that's done. And then the woman is out of the operating room.
Wow, that sounds.
Yeah.
I don't have hydrosalpinx, but I almost want to do a
How do you know?
hysteroscopy. Well, true. How do I know, right?
How do you know?
Right. So I might have to go through the whole diagnostic
Oh, yeah,
procedure.
exactly.
So you also may not know whether or not you have this. So
Mhm.
it would do you well to actually check that out with your gynecologist. Maybe you and I can book a session with
and
book an
and uh,
appointment
and you
with
know
Dr.
you know
Ken.
you know what, you actually really don't know sometimes if you have it or not,
Hmm.
because the infections that usually cause them are usually salient infections like the chlamydia.
Okay.
A woman just get a chlamydia infection without even knowing she's having any infection,
Hmm.
and nothing damages the fallopian tubes like the chlamydia,
Wow.
and it passes quietly.
Very.
Yes. So
That's
that's
more
why a good
scary.
number of women will not know. It just is an incidental finding when they go for hysterosalpingography, HSG, or the laparoscopy and the
Yeah.
dye test. You just see the fallopian tube so big,
And then you're like,
very big, like,
wow.
I don't know, like a
But how
scorpion.
small is it usually? Or how,
How
what's the size of it?
tiny?
Yeah.
The pen,
Yes. Yes.
the part of a pen that has the ink.
No way.
Yeah, so the bore of the fallopian tube is just like that.
Oh,
Yeah,
wow.
even a little smaller than that.
That
But
is
the
really
entire
small.
body of the fallopian tube may just be like the smallest pen you've ever seen.
Oh, wow.
The thickness is just like 5 millimeters.
That is really small.
5 millimeters.
And then
Exactly.
you, but
It's actually smaller than this.
hmm.
Yeah, it's not as thick as this.
Wow, that's
So when it's getting
interesting.
thick, it's already a problem.
It's that does sound like it. It sounds
Mhm.
like a very little amount of
Exactly. So it's very
those
delicate
fluid
and it
like
needs to be
things.
protected.
Yes, it does really.
So to take care of the fallopian tubes with hydrosalpinx, you can block it using the clips,
Yeah.
laparoscopic clips, to just block it so the fluid is there but it doesn't communicate. For whatever reason, a woman wants that, it can be done. Or you drain it and administer antibiotics. I don't like that, but it is something that can be done. But the fallopian tube is bad. Why do you want to leave it there? It just as you rightly asked. Okay, so you can be drained and hope that whatever caused the accumulation
It
doesn't
doesn't come
happen.
back, but
And
yeah.
then you could cut it off completely. Then, of course, you could do hysteroscopy and occlude it from this
The
connection to the
inside.
fallopian tube.
So that's done on the inside
From the
of the
inside of the
uterus.
womb
Oh
now, you do
wow,
that.
that
Yeah,
sounds
you
really
do it from, yeah, you're
interesting.
thinking about that. That's true. From the inside,
Mm-hmm.
of the womb. Yeah.
Yeah.
So we do that a lot because we have the probe for it. You just send
Okay.
the probe there and you just press some energy
And
and it just takes care of the fallopian
that's
tubes.
so
But of course, when that is done, its fallopian tubes are gone completely.
yeah.
You've blocked their connections.
Mm-hmm.
So a woman can only get pregnant by IVF. Usually, when the fallopian tubes are bad, whether you remove them or not, it's IVF that needs
IVF,
to be done. So
yeah.
whether you take them out or not,
I
you still need
mean,
IVF anyways.
picturing how small it is, it's just
Exactly.
like it's gone.
Yeah, yeah.
It's
Mhm.
basically gone. But
So that's just the problem with hydrosalpinx.
hmm,
So if a woman has hydrosalpinx, it is a big deal.
yeah,
Yeah,
it
and
does
because
sound
from
okay.
this part of the world, the major cause of infertility is 40% of infertility is caused by abnormalities of the fallopian tubes.
Hmm.
Then, of course, now 40 to 50% or even 60% is caused by sperms.
Wow.
So forth. Then fallopian tube is a big deal.
Yeah, it is
Yeah,
actually
it
because it's
is.
still
So,
making up quite a
yeah, yeah.
big percentage of
Mm.
that. I mean, this is interesting.
Uh-huh.
Yeah, I don't know if there's anything I missed or anything that you would want to tell viewers about hydrosalpinx that have come up in conversation yet.
You know, um, you know, when we are doing core gynecology,
Hmm.
to the core gynecologists, the fallopian tube is very sacred. Whether it is disease or not,
Yeah.
they want to leave it alone. And I think that is not the right way to look at this.
Hmm.
Leaving it alone is exposing the woman to a big risk. One, it's useless. It's useless. What would you do? What will you achieve leaving it?
Mm-hmm.
Most people want to see that the woman conceives spontaneously. But the best thing to do is to take out the fallopian tube when it is bad.
Yeah.
Just the same way, a lot of doctors feel that fibroid should be left alone when it is not necessarily affecting pregnancy. What do
Wow.
you mean fibroid affecting pregnancy? All fibroids affect pregnancies.
Yes, I
The
can
small fibroid
imagine.
today is a fibroid that will become bigger tomorrow, and the bigger
Exactly.
it gets, the more problem it causes,
Mm-hmm.
the more difficult it is removing, the more complications you have addressing it.
Yeah.
So we should have a proper perspective to all of these reproductive tract pathology or abnormalities. Okay, so you hear doctors say, "Oh, liver when she has delivered will take out the fibroid." I don't take that point of view.
Mm-hmm.
Take it out.
Yeah.
Yeah, yeah. So long as there's infertility going on with it, take it out and make the woman comfortable.
Mm-hmm.
The same way I think we should address hydrosalpinx. If a woman has challenge getting pregnant and you discover hydrosalpinx, it should actually be removed.
Yeah.
It should be dealt with in a way that it doesn't pose risks on
To.
subsequent pregnancy or attempts at
Mm-hmm.
getting pregnant. By the way, I think all hydrosalpinx should be evaluated based on the clinical merit of the individual having it
Mm.
vis-a-vis pregnancy, pregnancy and clinical symptomatology.
Yeah.
But it causes infertility and it needs to be addressed
It
as
does.
such.
It does.
Yes,
It
and I'd say
does.
that if women have infection, they should treat the infection aggressively
Mm-hmm.
because infections can cause hydrosalpinx.
Yes.
Surgeries, complication of surgeries, adhesions following surgeries could
Mm-hmm.
cause hydrosalpinx.
So wow.
Yeah. So
Mm.
we should address it.
Yeah, I think so too.
Uh-huh.
I think we should as well.
And when you are preparing for IVF, it's almost a must
I mean,
to take out the
hmm,
hydrosalpinx.
because imagine going through the whole IVF
Exactly.
and then that fluid now decides to
To you get
to come
pregnant
back
and it
and
comes to
then
washes
wash
it off,
everything away
or
and
poisons
exactly.
toxic fluid becomes
Hmm.
poisonous to the embryo.
So there's no room for growth
There's no,
there.
yeah.
Yeah.
So it's better to deal with it as aggressively as possible.
Okay, well, thank you so much, Dr. Ken. That was really interesting
Hmm.
and humorous as well. I hope you enjoyed this session as much as I did. I mean, you can tell I couldn't stop laughing. But yes, hydrosalpinx is a very serious thing. And as little as that fallopian tube might be, you can see that it affects the entirety of your fertility journey, natural or assisted. So yes, look into that. If you have concerns about anything related to your reproduction or your fertility process, do not hide it, do not keep it in, okay? Like you said, this doesn't always come up with those specific symptoms, is as a result of something else. So do well to see your gynecologist for that. Thank you so much for sticking with us. We do enjoy having you here every time, okay? Do make sure to follow us on all our other social media: Facebook, YouTube, Instagram, and even TikTok. Yes, for my Gen Z girls. We're on there as well. So you can follow us, turn on your post notifications so you know when we're going live next time, and you don't miss the next topic, because we do have something new for you every time. And we just want you to be more informed about your decisions around your fertility. All right, then. See you next time. Bye.